Hello everyone and welcome to Blood and Hematology YouTube channel. This video is about B-cell prolymphocytic leukemia, an extremely rare chronic B-lineage lymphoproliferative disorder. Prolymphocytic leukemia, PLL, is a rare mature lymphoid leukemia that can be derived from B or T cells. PLL is defined as the presence of more than 55% prolymphocytes in the peripheral blood and bone marrow. B-cell prolymphocytic leukemia, B-PLL, is an extremely rare chronic B-lineage lymphoproliferative disorder with prominent splenic involvement, specific cytological features and an immunophenotype resembling that of Non-Hodgkin lymphoma rather than CLL. B-PLL is no longer recognized in the 5th edition of the WHO classification. Cases previously classified as B-PLL are now recategorized as either prolymphocytic progression of CLL, SLL, or splenic B-cell lymphoma or leukemia with prominent nucleoli. B-PLL could arise either de novo or from prolymphocytic transformation of CLL. In these cases, prolymphocytes retain the immunophenotype of CLL, though they show a brighter surface immunoglobulin expression. The highest incidence of B-PLL is in the 7th or 8th decade of life, with a slight male predominance. Old age, massive and prominent splenomegaly, high white cell count, and anemia with or without thrombocytopenia are the classical clinical features of B-PLL. Peripheral lymphadenopathy is uncommon. The clinical course is more aggressive than that of CLL and the therapeutic response is generally modest. The median survival is around 2 to 3 years. Anemia and a high lymphocyte count have been found to correlate with a worse prognosis. A positive direct antiglobulin test and autoimmune hemolytic anemia can occur. The serum immunoglobulin concentration is often reduced and a paraprotein is present in about a third of patients. The leukocyte count is always elevated in 2/3 of patients at diagnosis. Because of the massive bone marrow infiltration, there is coexisting trilineage hemopoietic insufficiency with anemia, thrombocytopenia, and neutropenia. The median hemoglobin at diagnosis is 9 gram per deciliter, and thrombocytopenia is more moderate with median values around 100,000 per microliter. Prolymphocyte is a medium-sized cell with moderately abundant and pale weakly basophilic cytoplasm, round or oval and sometimes indented nucleus, condensed non-clumped chromatin and a single large prominent nucleolus. B-PLL shows bright expression of B-cell markers, surface immunoglobulins, CD11C, CD79A and CD79B. CD5 is expressed in 20 to 30% and CD23 is expressed in 10 to 20% of cases. CD25, CD200, CD10, and T-cell markers are not expressed. The table shows the characteristic immunophenotype of PLL and other chronic B-cell leukemias and B-cell lymphomas. In PLL there are often complex karyotypic abnormalities. Cytogenetic abnormalities, c-MYC aberration, and 17p deletion TP53 mutation are seen in about 75%, 60%, and 40% of B-PLL cases respectively. Based on the c-MYC aberration and deletion 17 TP53 mutation, B-PLL is classified into 3 prognostic groups: low risk, intermediate risk, and high risk. The B-PLL patient for presentation is a 77-year-old woman with hyperleukocytosis and marked lymphocytosis. Few smudge cells and 86% prolymphocytes were observed in peripheral blood smear examination. The homogeneous leukemic population in the peripheral blood are medium-sized or large cells with a plentiful halo of cytoplasm. The nucleus is large, central or slightly eccentric, with condensed chromatin and single, pale and easily visible nucleolus. Peripheral blood film from B-PLL patient showing cells that are regular in shape with round nuclei. Nuclear chromatin shows some condensation and the larger cells have prominent vesicular nucleoli. Peripheral blood lymphocyte immunophenotyping by flow cytometry revealed a pronounced increased B-cell population. B-cell immunophenotyping demonstrated B-PLL expression pattern. Thank you for watching this video. If you liked this video, to give it a thumbs up and share it. Do not forget to subscribe to the channel, if you still have not. You can click on the bell to receive notifications whenever a new video is uploaded.